Good afternoon. I am Ellen Jones, the Public Information Officer for the Anne Arundel County Department of Health, and welcome to the Health Department's COVID-19 Facebook Live broadcast. The first part will feature our health officer, Dr. Nilesh Kalyanaraman. But we also have a two-part show today, and the second part will feature our department's Behavioral Health Deputy Director, Tracy Shulden, who will talk about mental health and drug and alcohol use. We also have our Assessment and Planning Director, Crystal Coldiron, who will talk about data and health equity. They will all provide answers to appropriate questions submitted by you in our Facebook AA Health comments or by email at covid19info@aacounty.org. So let's begin with some updates from our health officer.
Good afternoon. It's good to be here with you again today. Wanted to start off, as I usually do, talking about social distancing and infection control when we're talking about COVID. Those continue to be the mainstays of what we are doing. For the past month, actually more than a month now, we've been emphasizing the need for social distancing, keeping 6 feet from others, making sure that you minimize going out to either stores or other essential activities, making sure that you have good infection control, and that includes masks or face coverings, frequent hand washing or hand sanitizer use, disinfecting frequently touched surfaces. Those are the mainstays of what we're doing. And we're starting to see the effects of those actions that each of you are taking. And we're seeing that based on the projections that we've been looking at. We're seeing fewer hospitalizations and a slower rate of infections over time. There's still a lot of time for us to talk about all of the interventions we need to do, but right now it looks like we're making progress. Part of that is making sure that we stay ahead of the curve. That means looking at what more we can do to decrease the rate of spread. And so for that reason, there are a few things that we've done in the past few weeks to make sure that we're ahead of the curve on that. We've talked about providing data at a zip code level to give each of you more information about what's happening in your communities. We're a big county. There are a lot of neighborhoods and a wide spread between those neighborhoods. And so giving you that information allows you to understand what's happening and understand the types of decisions you need to make. We've also put out guidance about face coverings and social distancing in retail spaces. I know that's led to a lot of questions since that came out yesterday. The spirit behind that is to make sure that when you go out, that you are staying as safe as possible while you are at a grocery store, at a pharmacy, whatever it is. At the same time, we need to make sure that we are keeping those employees of those businesses safe as well. They're coming into contact with a lot of people every single day. We're happy that we were leading the way on that, and in fact, just about a half an hour ago, the governor announced that statewide, people are going to be required to wear masks when they are out in a business, and employees will have to as well. And he specifically noted the work of our county and 3 other counties in leading the way on this. These are steps that we are taking to make sure that we are continuing to slow the spread of this disease. Additionally, and you're going to hear more about this in the second half of our show, we've been pushing on health equity, making sure that everybody has the opportunity to be healthy in this. We know that when there are health disparities, a public health emergency only makes that worse. And so we had our first video call on health equity earlier this week on Monday, and Crystal Coldiron will tell you more about that and more about the steps that are coming out of that. And we're really excited about that because that is what is going to be required in the long term to ensure that we continue to identify those at even greater risk and target resources to them. We also talk a lot about hospitals and their capacity. That's an area that we actively work on. I, the county executive, and others meet with the hospitals weekly. And in fact, that's a part of the reason that we've changed the format of our show today. At 3:30, I have to be on a call with the state, county executive, and others about our hospital surge capacity. And lastly, I will always note, be kind to yourself and be kind to others. This is a trying time. This is a hard time. And we need to be able to show grace to ourselves and others in this time. And so with that, I think it's time for questions.
Yes, we have lots of mask questions. The first one is, we understand that if you have medical conditions, you may not need to wear a mask. So please give us examples of what medical conditions would inhibit someone from wearing a mask or face cover.
So there are a few medical conditions where it's probably not advisable to wear a face covering. For people with COPD or emphysema, where that could make it difficult for them to breathe, we certainly would understand if you couldn't wear a mask out in public. At the same time, we would also encourage you to find other ways to accomplish those tasks because you're already at a greater risk. And so for anybody who has a medical condition and who needs to go outside, we really encourage you to minimize your time, particularly if wearing a mask is difficult for you. It puts you at even greater risk. And so emphysema, COPD, anatomical abnormalities, those of you who have these conditions know what we're talking about. And if you need any guidance, you can certainly call the health department.
Thank you, Doctor. The next question is about finding a proper mask. What do people do if they can't buy a mask? Is there another way to get a mask or a face cover?
So I want to encourage you to not feel any pressure to buy anything. You can make a face covering with what you have. We've put out videos around how you can do that with a bandana. You can use a square of cloth. You don't have to pay for this. Please don't feel that you do. And please check our website and please check our Facebook feed as well for videos, not just our health department, but there are other videos of how you can do this on your own.
For businesses, how can I report a business that is not in compliance with wearing face covers or social distancing standards when working with the public?
When you see those sort of instances, you can call the health department. Our number is 410-222-7256. Our first action is actually to go out to that business to understand what their barriers are and work with them to figure out how they can put those safety measures in place. That's social distancing, the face coverings. Our goal isn't to punish anybody. That's really the last thing we want to do. Our goal is to make sure that people are safe while going about their activities.
If my delivery person does not have a mask, should I be concerned about the food and handle it a certain way?
I would say that whether or not they're wearing a mask, you should certainly, and we've talked about this before, you should certainly wipe down the surfaces that your food containers are, whether they're plastic, particularly if they're plastic. Sorry about that. And make sure that you wipe them down before opening them and eating your food.
Masks do require certain responsibility. So what precautions should be taken when putting on and taking off a face cover or mask?
So when you're using a face covering, like this or like any homemade one, you want to make sure that it's covering your nose, your mouth, and the sides of your face. So anything that you put on should be able to do this, covering these sides. When you're taking it off, you want to make sure that you're taking it off from the sides, not putting your hand on it. Because part of the way that these work is by preventing anything that you're breathing, any virus, it's gonna stick to the cloth and prevent you from breathing it. So you don't want to actually touch this area as I'm doing right this moment. And you also want to make sure that you use hand sanitizer or wash your hand after taking off your mask, and that you wash your mask at least every few days, more if you're using it heavily. So if you're outside multiple times in a day, wash it in soap and water each day.
Thank you, Doctor. People are also concerned about fines. This question comes, will I get arrested for not wearing a mask, or will I be fined for not wearing a mask?
So we are not interested or looking to enforce mask usage by the public with either fines or arrests. This is meant to help protect you. And so the more each of you do, including face covering usage, the healthier you will be and the healthier others will be as well. For businesses, we are also not looking to fine them. We are looking to provide guidance, support, and training as needed to have them put into place the safety measures needed. If we find that a business is repeatedly not willing to protect the safety of its employees and its customers, that is really the only time that we're looking at enforcement in terms of penalties. But our intent is not penalties, it's safety.
Thank you, Doctor. Do employees in a regular office building have to comply with the face covering guidance, or is it only for retail businesses?
Currently, it's for retail businesses. We have to review the governor's order. As I mentioned, that just came out literally in the last hour. The county's guidance was around retail businesses only. So stay tuned on this. As each of you know who's watching this, things move rapidly, much more quickly than we're used to. And so we'll be reviewing the governor's order, having our order sync up with that, and putting out additional guidance in the next day.
Back to employers. Should employers provide masks for their staff, and how can that be helpful for business as well as for their employees?
We'd ask employers to ensure that their employees have masks if that's working through with them how they can make their own, providing materials, whatever they need to do to be in compliance with that is what we would recommend. If that is providing the mask, then they're certainly welcome to do that as well.
Thank you. Now that's it for the mask or face cover questions. We're going to move on to testing because we do have a lot of questions about testing. Is testing for antibodies available in our county, and how will antibody testing eventually help us get back to normal?
So, to my knowledge, antibody testing is not available in the county yet. There's only one manufacturer that has the regulatory authority to put out their tests at this point. I know that the state just announced an agreement to get antibody testing in the state. So we have to find out how much of it there is, and we're still working through how we are planning on using it. So right now, it's such a new test and isn't even properly available yet that I don't have much guidance on how we will use it yet, and we're hoping to know more in the next few days.
How does the county plan to get even more tests and improve the time for getting the test results?
So we've been working to increase the number of tests. I know that at the drive-through testing sites in Glen Burnie, we've upped it to 100 appointments from 70. I know that at our Anne Arundel County Health Department site, we've increased it to about 40, and we're looking at having additional sites out in the community come online. We are finding that the test results are coming back in 2 to 3 days at this point for us. And so that test turnaround time has come down a lot since we first started doing those tests a few weeks ago.
Dr. Nilesh, one of our comments has, what is the point in being tested when you can be negative, get the virus the next day, and spread it?
That's a great question, and that's why we recommend right now that only people with symptoms get tested. And we know that people who don't have any symptoms, if we test them, that's exactly our concern. That you could get it at some later date. It doesn't mean that you're clear. It just would mean that you don't have it at that point. And so we continue to recommend at this time that only people with symptoms get tested.
With more testing, people are asking about the surge, and when is the surge expected?
That is one of the hardest questions to answer. And the reason for that is that the surge is based on projections. So they're based on assumptions that are made that will help us project what may happen in the future. As I mentioned when I started, the social distancing and infection control steps have made a real difference in what we are seeing compared to what we were expecting. And so the ranges of when we're going to see the surge vary from in the next few days to weeks to the end of May. It's hard to say, but generally what we're seeing is that sometime in this next 6 weeks, we'll see the surge. But I want to caution you that the surge isn't a date or an event. It's an increase in the number of people who are getting sick, who need hospitalization, and then at some point we reached our highest point, but we still see significant numbers of people who are sick. So it's better thought of as a 4 to 6 week long process of increased numbers of sick and hospitalized patients. And so as we see more unfold over the next week or two, we'll have a better sense of what our trajectory is.
Interesting. This question is about contact tracing, which has been in the news a lot lately. How does the ability to do quicker contact tracing help stop the spread?
So contact tracing is when we, as a health department, when somebody is COVID positive, we contact that person and we give them instructions and guidance around how to do isolation. We also talk to them about people who they've been close to physically, who may have been exposed to them while they had symptoms, and we call those people as well, assess them, and advise those people to quarantine themselves. The difference between isolation and quarantine is isolation is when people sequester themselves in their home or where they are staying. Quarantine is when they do that but they don't have any symptoms. And then once we make that initial contact, we follow up daily to see how they're doing, both those in isolation and quarantine, see how they're doing, see if they're getting better or not, and make sure that they have the resources they need to be able to safely isolate or quarantine. The way that helps is that when people are known to have disease or known that they may have been exposed to it, making sure that they are not in a position where they're spreading it to others slows down the spread of that disease. And it's something that we do in public health for any number of infectious diseases and have been doing for years and decades. It's much more prominent in this setting of COVID because we're talking about it in a way that's much more public. We at the health department have been doing contact tracing for every single person who has been positive in our county. That's over 800 people and growing. And we've actually expanded our staff significantly from 7 people to over 40 people to be able to do those contact tracing, over 70 a day at this point. It's a key part of what we're doing now. And more importantly, it's going to be a key part of how we sustain our advances against COVID in not just the weeks and months, but the years to come.
Thank you. We have some questions about some of our most vulnerable population here. How has the health department helped nursing homes and assisted living facilities be prepared for any patients or staff with COVID-19?
That's a great question. So we've been particularly focused on vulnerable populations, including the nursing homes and assisted living facilities. And we have been, for weeks now, talking to those facilities, making sure that they have the proper protocols and procedures in place to identify people who have symptoms, both staff and patients. have ways to provide isolation for those patients, quarantine, have enough staff to be able to keep people at home if they have any symptoms, providing PPE, providing testing at those sites immediately, and providing those results within a day, no more than 2 days. And then we've also been working in concert with the state health department to provide additional guidance and support for those who need it. So it's been something that we've been working on for many weeks now in the context of COVID, and is one of our key areas that we focus on.
Thank you. Another population that we have questions about: how are inmates being taken care of with the prevention and testing for COVID-19?
So we've been actually working with county corrections since day one. They've been not just a critical but an amazing partner in this work. They beat us to the punch. We wanted to call them. They called us first and said, "What do we need to do to be safe?" And really, we took how they work with their flu protocols and adapted them to make sure that there's social distancing, that there's infection control, that they can get testing done for both their inmates and their staff, with those strike teams that I mentioned that would go out to nursing homes. They can also go out to the correctional facilities, and making sure that we have a pathway to get them into isolation and quarantine as needed, not for disciplinary purposes, but for public health purposes and to safeguard the health of others.
And Doctor, what about the homeless in our community? How have the homeless been helped through the health department?
Along those same lines, we've been working with the homeless shelters and winter relief. Winter relief has been extended. We've been working with DSS very closely on this issue. We've moved a number of people into hotels so that we can decrease the concentration of people in shelter. We've put in the same time and work to provide guidance and support around social distancing and infection control, and that on-demand testing is needed. So we've been pretty consistent in providing that range of services to a variety of vulnerable populations.
Thank you so much. We also, as always, have questions about symptoms of COVID-19. Are a fever, sore throat, and diarrhea symptoms of COVID-19? We've heard that they are. And what are the other symptoms?
So the main symptoms that we ask people to look for are fever, cough, and shortness of breath. And the reason for that is that those are the most commonly reported symptoms for people with COVID-19. There are other symptoms that are also reported, but at much lower rates. Diarrhea, sore throat, a loss of sense of smell or taste are also reported, but they don't happen as frequently as those first three symptoms of fever, shortness of breath, and cough, and that's why we rely on those three symptoms as our triggers for testing.
Interesting. Since this is a respiratory illness, are there outside factors such as exposure to smoke, vaping, bonfires, and heavy fumes that could make the symptoms worse?
In general, what we find with other respiratory infections is that people with compromised lung function, so people who are smoking or vaping, or people with COPD, emphysema, or other types of lung diseases, tend to be more susceptible to infection with a respiratory virus and to worse complications. We're seeing reports that in COVID-19, specifically smoking and vaping, do increase your risk of getting it and having more severe version of it. And so I think our general guidance is that with any of these, with any types of respiratory illness, if you can stop smoking, vaping, please do so. It's going to protect your health in general and with COVID-19.
This time of year, so many people have allergies. How can you tell if you have an allergy, a cold, or COVID-19?
That's a good question. What we see with allergies, particularly, is that you certainly can get a cough, but we also see sneezing and some watery eyes, runny nose, symptoms that are more consistent with allergies. Also, one thing to think about is when you're having the symptoms. If you find that your symptoms are occurring outside but not inside, that's also certainly a good clue that it's related to allergies as opposed to COVID-19.
If you've had COVID-19 and recovered, do you still need to be quarantined if a family member in your house gets it later?
That's a really good question. Right now, we are actively trying to understand that because we are just starting to reach the point where people are recovering and may be exposed again to others. We're trying to figure out the answer to that, frankly. Our best understanding is that if you've had it, you have some degree of immunity, and you shouldn't be able to get it again. And so that's our current understanding. We're still looking into that, and I don't have a firm answer for that yet, but we're trying to figure that out.
Thank you. For prevention, is it okay to use expired hand sanitizer and reuse disposable masks or face covers? Now that we know that hand sanitizer and face covers are important for preventing the spread.
Generally, expired hand sanitizer should be okay, as we recommend that the hand sanitizer contain greater than 60% alcohol, and there's no reason to think an expired hand sanitizer, as long as it's within a few years, should be any less effective. With expired masks in the healthcare setting, there's been extensions of the expiration dates, meaning that masks that have been expired are still acceptable to be used. The same guidance really applies. If your mask is soiled or dirty, if you've been using it a lot and is not functioning properly, you should discard it, but you should certainly feel free to use a mask even if it's expired.
Are face covers required anytime you step outside of your house or go for a walk in your neighborhood because you don't know how far away people will be?
Well, face masks aren't required for that. They are recommended for that. For that exact reason. You don't know who you're going to be interacting with. You don't know who might come close to you or you might get close to. And so for that reason, we do recommend the face coverings in that setting.
Okay. We always ask about the surfaces. How long can the coronavirus stay on a cell phone and an iPad?
Generally, we see that it lives for up to 24 hours one day on porous surfaces, so paper, cardboard, that kind of thing, and up to 3 days on non-porous surfaces like wood, metal, plastic. Sorry, not wood, metal and plastic. For iPhones, iPads, those kind of devices, you should wipe those down. If they're frequently touched by others, and it can last up to 3 days on those devices.
Thank you, Doctor. Well, we're almost ending our first segment. Do you have any points to make for the viewers here?
I do. Once again, thank you for joining us thank you for joining me for the first half, and I'm looking forward to our segment on mental health and looking at data and health equity. I just want to remind you that a lot of the gains that we've made from social distancing and infection control are really great to see, and we need to keep them up and keep pushing forward. So I always end with reminding you that you have the ability to impact how this disease goes. And so your actions, no matter how small they may seem, matter. They matter for you, and they also matter for those around you. So thank you for everything that you've been doing.
Thank you. And now it's time for our intermission. Hi, welcome back to COVID-19 Facebook Live with the Health Department. The second part of our program features our department's Behavioral Health Deputy Director, Tracy Sheldon, who will talk about mental health and drug and alcohol use. We also have our Assessment and Planning Director, Crystal Coldiron, who will talk about health equity as well as data. So let's start with Tracy. Hi, Tracy. What are some signs that my child may be experiencing anxiety?
Okay, let me bring my mask down the correct way. So children express anxiety in a variety of ways. There could be reassurance seeking, where they're maybe constantly asking questions like, are you okay? Is grandpa going to be okay? Is this the end of the world? Is this, if they're constantly asking questions to be reassured. Reluctance to be separate from you, they may become more clingy. Physical symptoms such as headaches, stomach aches, they can become moody, irritable, maybe tantrums, meltdowns. You might see them regressing in some of their behaviors, like if they had finally managed to master a task and now are back. Trouble sleeping, watching them eating more or taking food to deal with their emotions. These are all, this is a fearful, anxiety-provoking time, so it's normal to have reactions like this. It's really important that you just tune in to them for the frequency to see if they're increasing, if they're being sustained over a long period of time. So checking in with your kids. Young children have a hard time expressing how they're feeling. So sometimes you can do a simple thing as a chart. I always like the traffic sign with green, red, and yellow, and they can even draw their little circle and they can let you know how they're feeling that day. I think it's pretty simple as to what the green, red, and the yellow means. And then older kids that are able to articulate their feelings, just checking in with questions that actually engage them in conversation and not just, how are you feeling today? And okay. An older kid's topic. You might have read an article. How do you feel about this article? Which will get them into that kind of discussion. So, providing structure for them will help if you feel that they're anxious. Reassuring them, but not over-reassuring them, because sometimes in our own anxiety, we might constantly be reassuring, which is like giving them the feeling that there's something they should be worried about. And the best thing is to model the behavior yourself. Tell them what you're doing. How are you staying, handling the situation of being anxious or self-isolating, big word. Because what they're going to learn, they're going to develop these skills by watching you and how you modeled that behavior. And we're all in this together.
Thank you. Yes. Now, we do have a question about teenagers and how to bring up points in the daily conversation to make sure a teenager who may be quiet is okay.
So that's what I talked about. Teenagers tend to not be very communicative. I've noticed in my own household that I'm getting more contact with my teenager now than I had before. Actually, she's not mine, she's my niece, but they are at an age where they can engage in a conversation, and it may be starting it by, like I said, if you read an article about something that was intriguing, they love to debate. So pick an article that is about what's going on. Somebody may have had an opinion and, say, hey, I read this, it was interesting. What do you think about it? And you can really get from what they're talking, get a sense of where they are. And so I found that to be very effective.
Maybe talk about face coverings.
Yes, you can tell all the ways that you can keep yourself safe.
Yes.
And hygiene. I've said that before. This is a good time to really bring home the fact that good hygiene is good for everybody.
Thank you. Most of us who've gone shopping recently have this question. Why do people panic buy and hoard things for no obvious reason?
So I'd like to say that there's a basic reason, and the basic reason is we all want to have the essentials moving forward. We want to make sure we have enough food, We don't know how long this is going on. We do this when there's going to be a snowstorm. A lot of times, we know that's only going to be a couple days. This threat is pretty significant, and there's really no clear end. So some of us who may not have hoarded or gone to get all the food and the toilet paper may eventually do that because they're watching people that they look up to or they feel respect in how they're managing something. And when you're seeing people going to get the toilet paper, you start thinking, maybe I do need to go get the toilet paper. Maybe I do need 5 gallons of milk. And so that's called a herding response. We all herd in and take over. Plus, there's a lot of lack of control right now. So our ability to have some control by making sure we have the food gives us some comfort. And really, it's a perceived scarcity, and we have to try to break that panic, which is really hard. And supermarkets have been known to do this. This is why they put where you buy only 2 of something. They may limit the hours or when you can come in, and it's all trying to break that cycle of people's response to that they need to stock up.
Thank you. With the statistics, with the illnesses, and with the deaths, and with loss of family members, how are we expected to handle grief without contact at the hospital and without saying goodbye physically?
This is a very trying time. It's a very difficult time to deal with that, knowing that our people are often left alone when they're suffering or when they're sick and we're not able to be there for them. When we've lost them, not being able to partake in the community aspect of grieving for our individuals and honoring them. So what we need to do now is come up with other ways of dealing with that. There are virtual services when we've lost someone. We've engaged other people who are taking care of them to provide them information. We've had people do creative things I've watched on the internet where they've gone and put signs and stood outside the windows and read to them. It's really coming up with other ways to handle that, reaching out to people. It's a very trying time.
Thank you, Tracy. Talking about what's going on with statistics and data, with the illnesses and the reported deaths, Crystal, what zip codes in our county have the highest number of cases, and why do you think that is?
So far, we are just starting to improve our collection on racial data. And in fact, we were one of the first counties in the state to start kind of publicly sharing that information. Right now, not as surprisingly, we're seeing it in more of our higher populated areas, but we're working on fine-tuning that down to specific zip codes in different counties and areas. And we're working on trying to find those underlining areas. But right now, it's mostly we're just looking into the data now to see what those reasons are. So there's definitely going to be more to come on that.
We always get this question, Crystal. What are the differences in the way the state reports positive cases and the way the county reports positive cases on their websites and on Facebook?
We work with the state, the Maryland Department of Health, to make sure that we both have our own data collection processes, but we work with them all the time very closely. So this is more, it may just be the time when the data was pulled and when the report was published, but we work with them all the time to make sure that our data it just might be a timing thing.
Okay. Are you seeing certain demographics, race, ethnicity, gender, or regions by the county more prone to getting COVID-19?
Unfortunately, and I'm sure as many of you have seen on the news, it does seem to be affecting the African American community in higher numbers than other races or ethnicities. And it's very alarming. And one thing that we are you can possibly attribute to that is that we know that the African American community is affected by more of those underlying conditions that the CDC has warned us about as being more susceptible to the disease, such as diabetes, for example. So that could be one of the reasons why. We also know that there is there are more barriers to healthcare, for example, also, and perhaps other barriers for access to testing, and maybe having to go out into the workforce more, and maybe not having access to masks. So these are all things that we're thinking about, trying to see what the data can help us find out, and then we can provide targeted interventions on those things.
Crystal, that's good news about the targeted interventions. There was a health equity video conference earlier this week. What did the health department learn, and what are your next steps?
So we had a wonderful experience earlier this week. We originally imagined that this video conference would be with about 20 of our community leaders representing politicians, clergymen, Latino population, African American population, faith-based organizations, and it actually grew to over 100 participants. We didn't have as much. We knew that this was going to be a great opportunity to hear from these leaders. We know that we have ideas for how to address some of these inequities that I mentioned earlier, such as maybe lack of access to care or something like that. But these community leaders, they're the experts. They've been working in these communities for years, longer than I've been alive. So why not rely on our experts and those connections in the community to really make a difference? So that's our goal, is to hear specific targeted interventions that we can do to make a difference in our communities and help improve access and address those barriers and provide actionable solutions. So moving forward now, we're going to have a reoccurring meeting to make sure that we keep that line open and work together to address some of these issues.
That sounds great. How can people find out more about the upcoming meetings?
So we are working on updating our social media communication. So right now we absolutely recommend that you follow our Facebook page and Twitter page for Anne Arundel Department of Health, Anne Arundel County Department of Health. We also have a text line that the health department uses to push out information to hear about events and recommendations. And if you text JOIN, JOIN, COVID, COVID, to 30890, that's a great way to get updated on the upcoming information. So we'll make sure that we keep everyone posted on our upcoming events, and we definitely have a vision of expanding this reach to even community members as opposed to just community leaders. So stay tuned.
Great. That's very positive. Now, Tracy, there's an issue that many of us have forgotten about, and that is opiate ODs. The number of fatal opiate overdoses are higher this year than last. What do you think of some of the factors that cause this rise?
So first, I'd like to state that the health department has not forgotten about opioids. We have continued to be very on point on making sure all our services are being provided, and that the measures that we put in place to address the overdoses continue. While the numbers have gotten higher since last year, it's kind of hard. They started mid-January, so we really cannot put that on the pandemic. And there are so many different factors that makes it really hard to pinpoint. One, we're getting better at data collection. We also had the warmest winter on record, and if one thing we do know, that if it's warm outside, people are more likely to be out and using. There are also factors where traditionally protected communities that have some really strong protective factors, are finally being affected by the opioid overdoses. So there's just too many right now to figure out. It's been a short time, but we are keeping track of that and monitoring it and continuing to provide those services that are essential.
I know we have a lot of street outreach programs. So what is happening with the street outreach programs where you distribute Narcan and the fentanyl strips?
So we did initially put a hold on a lot of those programs when all this started so that we could put together new protocols. We are still providing Narcan. Anybody can reach out to the health department. We have that on our website, as well as you can always call our main number, which is 410-222-0117. The last time I was on here, I think I gave out 20,000 numbers. So we're going to stick with one, and we will route you to the right location. But we've also started doing some street outreach. We have partnered with homeless outreach by giving them Narcan. So when they're going out, they have that available to give out. We've also have provided Narcan at the food distribution locations. And we are now working with Annapolis as well as some other communities to start going out and providing that needed resource.
Thank you. Another topic that keeps coming up on Facebook is grounding. What is grounding and how does it help people cope? And what are some of the techniques I can use to reduce anxiety?
So grounding is something we all naturally do. You always hear people, I need to ground myself, plan ourselves firmly, but specifically it's a technique that's used to put distance between you and feelings of distress. Most of us do it intuitively. We've had a stressful day and we come home and say, look, I just need 30 minutes to get my stuff together. That's a form of grounding. Going and working out, listening to some music really loud in the car that takes your mind off what was so stressful for you, and all of a sudden you find yourself in the music. There's a technique for individuals that may be so into their head. That's a term. We get so wrapped up in our head we can't seem to break the cycle of the panic or the anxiety. There are very specific techniques that we can do. A very common one is the 5-4-3-2-1, where we take time. It's not just see 5 things, but to actually look around and describe the 5 things you see. Like I can see a monitor with the red light, and keep going around and do that for 5 other things, and then getting to 4 things that you can feel. Like, this feels very smooth. Something may be very warm. And then you have 3 things that you hear. If you hear the birds chirping or the complete silence of social isolation, what does that feel like? And going like 2 things you can smell. Is there any aromas that you can, taking lids off of spices? What does that smell? Was it very strong? Was it pungent? Was it very pleasant? And then the last thing is to taste something. And really think about what it tastes like. What did it hit first on your palate? By the time you've gotten through something like that, people often find themselves in a calmer place, that they've kind of taken the focus off what was ever causing them stress. But there are really simple techniques. You can grab some ice. I was going to bring some, and I rushed out and forgot my ice. But you can put ice in your hand and just sit there and feel it. Is it cold at first? Do you feel the numbing in your hands? How long does it take till it starts to melt, to watch it actually melting in your hands? These are all things that help you really just get out of your head and back to the moment of where you are. Dancing wildly, put some music on, dance through the house. Those are all forms of grounding.
That sounds exciting.
I use it a lot.
Yes.
And gardening, research has shown how gardening has been very effective in helping with anxieties. And what that is you're getting your hands into something and you're feeling, and the dirt's in your hand, and that is the ground. And it's a very effective form of grounding.
Thank you, Tracy. Well, we've almost come to the end of our Facebook Live. And I'd like for each of you to let the public know one thing about your program that they probably don't know about, but it really would be a good service to use.
Okay. You mean now or in general?
In general, and now too.
I think the important thing is to know that, I'm in behavioral health, so that's what we do is behavioral health services and helping people stay connected in a time where, we're socially isolating it's really more physically distancing and isolating, that we still have that need for social contact, and that can be done in various ways. So I think my thing that we're providing is that we're still providing these essential services. We're still providing counseling to families and children. We're still having our OTP. We're in our prevention work. We're getting very creative in how to continue our prevention services. We just had a call today. We do strengthening families. We've had to put that on hold. That's been a very successful program for our families. And we're now going to look at doing that virtually. We've had conversations, and our staff is really motivated to get that going, because the families they've been reaching out to have said, can we do this virtually?
That's great. And it's an outstanding program.
It is an outstanding
for families. Yes, definitely. And Crystal?
So I would say the takeaway from the Health Equity Initiative, which is making sure everyone can be as healthy as possible, is that our goal is to be evidence-based, meaning what has worked well in the past, and then analytics-driven, which means the data, and then community-led. So that's working with our leaders, working with our community to actually hear personally what we can do to intervene on some of these health inequalities and address them specifically in a targeted fashion. So that's our overall goal for that. And I will say just a plug to make sure that you fill out your census, because data the numbers don't lie. So that data can help us drive policy in a targeted fashion and really make a change in your community. So something to think about. But please stay healthy, please take it seriously, and we look forward to working with you.
Thank you. Thank you, Crystal. And thank you, Carrie, for helping us with the signing today. And thank you all out there for joining us for Facebook Live. You can also submit questions at COVID-19info@aacounty.org. Again, thanks for coming, and we'll see you later.